Governor, the state's numbers show 8 out of 10 of those vaccines have been put in arms, but those CDC numbers continue to lag, show us at the bottom of the country in distribution. Why that consistent discrepancy, and where are we compared to other states?
Well, I think we're doing very well for who we're targeting. And look, it's been the same way since day one. The media will always focus on the worst number, not the number that matters the most. And I think that's what's happening in this case. I'm looking at all those websites too. You don't see on that website where Georgia's at 60% of vaccinating people over 65 years of age, and the national average is 49%, and that the death percentage of people over 65 in Georgia is 77%. So on the advice of Dr. Toomey, and I agree with her, we have got to target the population that gets hit the hardest, and you're not seeing that on any site. Again, to reiterate what I said earlier, we can't control what the federal government is sending to other people that the state is not administering itself. I mean, we lose some in transit because when the doses ship, we get credited for them right away, even though we may not have even taken possession, and then we have to get them out to once we take possession, we have to get them out to the public health departments or the mass vaccination sites or the private sector partners, wherever we're sending them. So there's always going to be a little bit of a lag, but the federal pharmacy program, we can't control who's holding second doses. I don't think they should be doing that. They should be giving those doses. The supply chain is caught up. They don't need to do that anymore. They need to get shots in arms. We've urged them to do that. We've urged them to report data quicker that I think will increase our numbers. But if you look at what the state's controlling at our sites, we got 94% of shots going into arms, and that's with some weak demand that we've seen early on in the Albany area, and we're shifting those doses around to make sure that they're getting to other providers so that we get those shots in arms. So I think Director Stallings has done a great job, and that's why we're opening more sites, because we know we can be in a lot better range with what we control as the state than doses that are going to other places.